What's up, everybody? I hope you're doing well. If you are new to the channel, my name is Chirag Lathia, and I make videos on life sciences and business topics. In today's video, we're going to talk about national healthcare spending. So every year, the Centers for Medicare and Medicaid Services, or CMS for short, releases their report on the National Health Expenditure Accounts. This December, the CMS released their report on the 2019 National Health Expenditures. I took the time to read this report from beginning to end, and I thought the findings were quite interesting. So let's dive in. The National Health Expenditure accounts for the total healthcare spending in the United States. Dating all the way back to 1960, the NHEA measures annual U.S. expenditures for healthcare goods and services, public health activities, government administration, the net cost of health insurance, and investment related to healthcare. Today, we're going to be discussing the key points from this publication and what insights we can gather from this data. If that sounds good to you, please be sure to hit that like button and subscribe so you can be notified when I post new videos. In the National Health Expenditures account described by the CMS, the total U.S. spending was $3.8 trillion in 2019, which is up by 4.6% from 2018. That $3.8 trillion accounts for about $11,582 per person in 2019. Surprisingly enough, when I looked at the data, I found that spending on hospital care and professional healthcare services was more than 6 times higher than spending on outpatient prescription drugs. More than $2.2 trillion in 2019 healthcare expenditures came from hospital care and professional services. These are folks like physicians, dentists, and other healthcare professionals. These category spending growth has been consistent across many years. U.S. net spending on prescription drugs was $370 billion. So looking at the relative split, outpatient prescription drugs account for 9.7% of U.S. healthcare spending, having fallen from a 10.2% share in 2015. So outpatient prescription drugs is only 1/6 of the U.S. healthcare spend when compared to hospital care and professional services. Additionally, by looking at the year-over-year growth in spending, we can understand the relative size of these three major categories. From 2018 to 2019, the US spent $69.5 billion more on hospital services and $46.4 billion more on professional services. Meanwhile, spending on outpatient prescription drugs grew by $19.9 billion. So why is the spending changing year over year? Well, the CMS provided two major components behind the changes in spending. The first component is changes in utilization, which the CMS calls non-price factors, such as the use and intensity of services. The second is the change in prices, which is exactly what you would expect, an increase or a decrease in the price offered for the goods or service. This next one was really surprising to me. So if you look at the data, you can see that more than 100% of drug spending growth resulted from the number of people being treated and the number of prescriptions being dispensed. This is a really interesting key point, so I'll reiterate in simpler terms. In aggregate, the increase in spending is not due to price changes, but more due to the fact that people are using these drugs more often. So one question that comes to mind when looking at all this data is they state that the price of drugs are actually going down. So why is this? Well, the aggregate price declines come from two things: higher generic drug substitution and deflating of brand name drug prices. So looking at the data, we can see that pharmaceutical spend is only 1/6 of hospital and professional care services. So the main question is, why do people focus so much on pharmaceutical spending? Well, most patients and regular American people don't care about terms like health expenditures and net drug price. Patients care about the out-of-pocket spending, or the money that they spend for the goods and services directly. So another thing that we can look at from this report is the relative share of costs that patients bear for these different services. Looking at this figure really paints the whole picture and brings everything together. So for 2019, consumers' out-of-pocket spending for hospital care was more than $18 billion lower than consumers' out-of-pocket spending for outpatient prescription drugs. This means that even though hospital care is a greater share of spend, the patient is not bearing that cost directly. This is why patients are more unhappy about prescription drug spending than they are about hospital spending. As with all subjects on this channel, I strongly encourage you to dive deeper and do your own research. Let's get a good discussion going down in the comments below. Comment down below if you had any questions, and thumbs up if you like the format of this video. I will read all your comments and reply. In the description, I have added links and sources if you want to dig a little bit deeper into this. Please also consider sharing this video with a friend if you have learned something new. I've also placed a few links down below with my favorite services that I use on a daily basis. So if you would like to support the channel, you can certainly click through those. I'm looking to grow this channel to 1,000 subscribers within the next year. YouTube tells me that approximately 80% of you who are watching are not yet subscribed. So if you enjoyed the content and you have made it this far, please consider subscribing to this video. With that said, thank you so much for watching and see you soon.